As a mental health worker or someone affected by mental health issues, what is one thing you would want to say to educate people about mental health and to lessen the stigma and shame surrounding it? As someone who struggles with PTSD, I would like to say that I don't choose to be as repetitive and exhausting as I can be. I will react the same way to the same situation because that is an association that has been with me for half my life. It's very difficult to keep opening up to friends without feeling like a burden because you cannot cope with the same thing as last week. They have heard me talk about it so often and given me several pieces of advice on it, and I hate feeling like this broken record. But to me that is a core part of this disorder. Greater than feeling like a burden, this is a big one for me. My partner is the only one that I really open up to about my illness and my emotional issues that come with it. Every time I get over one thing, I shift that pain to something else. I feel like it's exhausting for him this year, but feeling like a burden is a symptom of my depression. The more I push that fact, the more I believe him when he says that I'm not bothering him with it. That feeling is what he's helping me try to fix. Even if your friends think that you come to them with the same things, I'm absolutely sure that they don't see you as a burden. You're a friend in need. We know we are acting irrational, but it's not something we could help. Especially if it's something like PTSD or anxiety. Some days are just harder than others. But that doesn't mean we aren't trying. Just being there for us is enough, and we appreciate it so much. The worst part of when I have a panic, anxiety attack is knowing that I'm thinking and acting incredibly irrationally. I know that it doesn't make sense. I fucking know. I keep repeating to myself over and over and over that I'm okay. Just breathe. I'm okay. But even though I'm telling myself that, another part of my brain is going, dude, get the fuck out of here right now. No, not that way. Sit down, stand up, sit down, fuck it, run, get out of here. You're going to fucking die right now. I know how ridiculous it is to think that just because I'm in a room with a lot of people or the passenger seat of a car, but knowing it's irrational doesn't stop my brain from yelling at me. Also, I always appreciate someone trying to help or asking to help, but sometimes I'm trying so hard to focus on not going into a full-blown panic attack that I can't tell you what you can do to help, or can even voice what's wrong exactly. Be patient with anxiety sufferers and do not tell me it's just in my head. Try to focus on something else. Tell me it's nothing. It sounds patronizing and makes me feel like I'm exaggerating or my feelings aren't real to you. Something to help with the stigma. Most people don't see mental illness until it has manifested itself outwardly. You know, the homeless guy yelling at a trash can type of thing. Realize that you are looking at the extreme end. Thinking that is what mental illness is like thinking someone with 90% of their skin scorched off is what a burn looks like. I had debilitating OCD, afraid to swallow my own saliva. Couldn't use old cutlery or cups, and needed to touch everything an even number of times or my soul might switch with that of an object. Nowadays I basically only double tap escalators and big silver pull doors because I'm afraid they'll static shock me. Not the soul switch thing. Greater than realize that you are looking at the extreme end. Thinking that is what mental illness is like thinking someone with 90% of their skin scorched off is what a burn looks like. Damn, that's an excellent analogy. I'm definitely going to use that the next time I find myself needing to explain this to someone. Exactly this. I'm the life of the party and a big happy noisy boss at work. When I come home I get straight into bed and stay there until I absolutely must get out again. Depression, anxiety, PTSD, bipolar and some sort of personality disorder. I've spent 20 years tweaking medication and doing therapy and trying really hard. I'm very lucky to have what I do given what I'm dealing with, and I certainly look mentally well. But it takes all my energy to live half of an ordinary life. I have moderate depression and generalized anxiety that is now somewhat successfully treated. meaning I am mostly functioning but I think I just look lazy and distracted. When I was at the bottom and just before I got my diagnosis, I told my flatmate I thought I might be depressed and she said she doubted it. I was usually so happy. She knew really mentally ill people and I didn't present crazy enough. It still hurts knowing that people don't fully believe I'm sick just because I don't show it enough. This is why I'm very open about it and really like telling people my experience. Because I was never really sad, just very lethargic and uninterested. And that's why I told myself I wasn't sick. Superb analogy. Physical therapy is seen as a regular part of recovery from any serious injury. There is no stigma attached for someone in a cast or a wheelchair to see a physical therapist. Mental health counseling should be considered in the same light. As someone with bipolar, I always compare it to diabetes. It's a lifelong condition, usually managed by medication, though occasionally people manage without. The medication isn't always perfect, so you have to let those around you know the warning signs. If you ignore, stop taking your meds suddenly, you will have serious problems and may embarrass yourself in public. Sadly, I've recently had to add an extra section to my explanation as part of an apology. If you're a diabetic in hospital waiting for your foot to be amputated, even if you took your meds perfectly, you get limited sympathy if you spend every weekend stuffing yourself with cake. For bipolar, the equivalent tends to be booze, drugs. And goddamn is the level of substance abuse high amongst us. My children's mother, my ex, is bipolar. As someone who spent years with someone who has bipolar disorder and fought hard to keep us together, I will say that it is one of the most misunderstood disorders out there simply because people don't understand the destructive nature of mania. Everyone understands depression in some capacity, but they think mania is just really happy. She was unmedicated and went into full-blown mania after what should have been our best times. Engagement, kids being born, and buying a home. Took so long to come to terms with how she seemed to actively destroy everything we built during our best times. I ended up going to therapy with a bipolar specialist after we split up just so I could understand it better. These days she goes to CBT weekly, takes her meds, and sees the psych once a month. And we are on great terms. I also genuinely hate when people describe themselves as a little bipolar. It undermines the severity of the disorder. I hope you stay well and continue to take your meds. Edited some of the language that was pointed out by people replying to be marginalizing. Yo, I also have bipolar. The worst part is when you're on a good roll with medication and then for some stupid reason it stops working. And the last time I went to the hospital with a meds-related issue, they outwardly asked me if I was seeking drugs. It's so sad that this thought process of mental health druggie exists and it needs to stop. Also, you're right in saying that it's lifelong. Also quite genetic. There's a pretty significant history of it in my family, so it wasn't a huge shock when I was diagnosed. I'm dreading tonight. Have to go to sober on short notice because of an alcohol pre-employment test on Saturday. My boyfriend is a type 1 diabetic, and I find myself comparing my struggle to his a lot. Oh, his is real. He needs his meds. But hell, so do I. This is a lifelong chronic mental illness and I need to take care of myself. ADHD exists. It's not just being hyper or condition therapists invented. If I was diagnosed as a kid, I might have gotten on my meds sooner and finished high school. I'd also like to add that ADHD doesn't always present as hyperactive, impulsive. There is also an inattentive type, and then the combination of the two. Especially for girls, ADHD or any autism spectrum condition is hard to diagnose. I have seen clear ADHD cases who have had bipolar diagnosed and the medication for that have ruined parts of their lives. And it exists for women as well as men. So many people have the idea that ADHD is a boy's problem that they grow out of. Nobody grows out of it. And for women, it can actually get worse as they reach adulthood. I was reasonably functional as a student, and then suddenly in my late 20s life just seemed to fall apart. Surprise ADHD. Not only does ADHD exist, its most devastating effects aren't even listed in the goddamn DSM. Less than 93% of psychiatric residencies even touch on it, so good luck getting properly medicated. Our disorder should more accurately called executive function deficiency disorder. It affects not just attention, memory, organizing, but our emotions, reactions, decision-making. ADHD is chronically misdiagnosed, can share interpersonal quirks with BPD, narcissism, bipolar disorder, so imagine how great we are with relationships. I've seen a lot of us agree that the rejection, dysphoria, emotional hyperarousal are the most crippling in our day-to-day. They're also not officially recognized as symptoms despite the fact they were included in earlier versions of the DSM. The evidence is overwhelming. Imagine how disrupted your life would be if you couldn't hear constructive criticism without it burning. A spouse asks a question and an imagined tone sends you spiraling. Career-ending performance fright because the sheer expectation of criticism is paralyzing. Everyone experiences those anxieties, but ours are a feature. The volume is way up. It affects us physically too. Muscle overdevelopment, pain, difficulty with fine motor movements have all been tied to ADHD. Idiopathic toe walking, to sensory sensitivity, which we have in common with autism. As here I am, done with ADHD deniers. I can literally see the proof in my DNA, so they are the flat earthers of mental health as far as I'm concerned. We know that sometimes you don't understand us, but please consider that sometimes we don't understand either. As hard as it is for you, imagine how hard it is for the person suffering through it. I don't know why I have to flatten out every single wrinkle in the sheet before I sleep. And I know my boyfriend is tired and wants to go to bed too. But if I don't, I won't be able to sleep and will be itchy all night. We're doing our best. Please just be patient with us. Thank you for watching. Comment, empower. If you have reached this far into the video, have a good day.